Thank you guys so much for joining. My name is Sierra. I'm the CEO and founder of Elite Precision Consulting. Welcome to Global Healthcare Summit 3.0. As the owner of Elite Precision Consulting, we focus on global facilitation, meaning how you can work with teams around the world to accomplish your goals, your missions. And we wanted to have this summit to further highlight the great companies and talents in different countries around the world. Some of these countries we have done business in pretty extensively. Others, it's new to us. And we also wanted to learn more about what's happening in their region, what opportunities are there, also how they can enhance their global collaboration, what partners are they needing to bring on board to further their mission, and maybe you as an attendee, maybe you have that solution. And so we're here to talk healthcare related topics. Although our company handles multiple sectors, we really love healthcare. We've been in healthcare for 17 years and just wanted to further amplify that. I'm going to introduce our next speaker. We're going to just keep things going. We were talking a lot about even sustainable healthcare. We're talking about policies and things like that. And I wanted to introduce our next speaker, Dr. Jodi Visnu from Indonesia, and just the wonderful things he's doing out there with the aging community, also just the hospital, health, philanthropy, consulting. I mean, he's going to go over everything. So I want to introduce Jodi. Thank you so much.
Thank you so much, Sierra, and also everybody here. Hello. Good afternoon from Indonesia. Good morning to all of you, maybe in some other parts of, from some, it's the GMT. Sierra always sent me the schedule with the GMT. We are in Indonesia GMT +7, so that's why it's already afternoon here. I'm just back from another outside of the town and having here, and really very pleased to be here today with Sierra and also the people I hope all over the world here, and joining the Elite Precision Consulting. And actually, I would like to share some slides here, actually, and to show this just a moment. Okay, I hope you can see already the slides. Okay, I'm so happy to be here today, actually, because I can share a bit about what I'm doing in my hospital, and also the service to the patients. And here, okay, so here's the slide. So okay. Yeah, I hope we have good connection here. Okay, so once again, okay, my name is Jodi Visnu. I'm from Indonesia. My background as a consultant in health philanthropy, also health marketing. I also a doctor of medicine, so still active in doing the practice today as a family physician here. Also, I'm working in, if you see at the corner, right corner in here, I can show you, this is the sign of logo of the Universitas Gajah Mada in Yogyakarta, in my place. Also, the hospital, I will show here, the Hospital of Panti Rapih, or Panti Rapih Hospital Yogyakarta, 93-year-old hospital, missionary Catholic mission hospital. I've been working here for approximately 2 years as a manager of the patients here, or we call it PRO, Patient Relationship Manager. I would like to introduce you to first about our hospital, the second what we are doing in the hospital, and the third about what is the connection between philanthropy and also what I'm doing in my hospital. So this is for Global Healthcare Summit 3.0. So here we are. Okay, I want to show you this about talking about the charitable gift. If you can see the cent here, the cent clock here. Well, when we talk about the charitable gift, it becomes only charitable or the charity, something else, anything you can mention. But if we put that to the sustainability, if we put that something, the charitable gift, doing more and doing more, it means like being sustained, or we call it the sustainability comes, it will be becoming philanthropy. We call it philanthropy when it has the aspect of sustainability. And the charitable gift is not only the money, actually we can put the charitable gift or the time to the people, the idea to the people, which is free of charge, which is we give our time, we give our idea, and of course we give our intrapersonal to the community, to whoever they need our help about this, or the donation, not only the money, but it can be another thing, another form. So we call it like a charitable gift as the philanthropy. So if we see this, can health philanthropy support the palliative and end of life care? I've been approximately 2 years patient relationship manager in Philanthropy Hospital in Yogyakarta. So if we can see here about the palliative and end of life care, some people will think about that the health, it's about to cure. You get sick, you come to the doctors and asking a doctor, I'm get sick like something else, and I will give the prescription and hoping that you will get cured and becoming well as well. But if we can see here about the health philanthropy and to support the palliative and end of life, we can see this some diseases here like cancer, stroke, dementia, chronic pain, the old age is like elder people, the organ failure like kidney failure, heart failure, also the pneumonia like a COPD, obstructive pulmonary disease. We can see the lung problems, and also we can see the other life-threatening diseases. We can see here like it won't be able to be cured somehow, but the only thing we can do is to accept the thing. This thing should going through the life, can be cured, or the patient can be quote unquote cured, and to receive that, to accept the situation, not only in bargaining level, not only in doing like, I don't want to get this, get rid this sickness of me, but to accept the things, and of course to support the family to the trouble like this. So that's why the patient can accept the problem, and the family can also giving the support here. But the question will arise to the hospital. How about the hospital supporting this? If we would like to get the palliative care team, should we pay? I mean, should the patient pay for this? Should the family of the patient pay for this? And it's like unethical if we charge the patient to pay such amount of money to the doctors who support the palliative care. And I will show you the next slide here. What we do in Philanthropy Hospital, we have the team called Pastoral Medical Social Support. This is a team-based care. Now, not only the doctor, but also like a counselor. We have religious people, and this team also supported by the hospital management. So the patient will not pay like out of pocket for this team. If they like, I'm sorry, I have to say, like if someone is dying, so that's why would you like to get the service from the palliative care support, and you have the money amount to pay like this? I guess this is unethical. And to put the patient like dying with dignity, firstly, we need to identify and we need to support the needs of the individuals. Some people can ask the lasting of his life about to get something else, to eat something else. We cannot put like you are getting the diabetic food and then you cannot eat something else about the sugar. You cannot eat like Coke. You cannot eat something else. But somehow like the tradition, like when he was a child, he would like to eat something else. And this is the end of my life. I would like still to taste the food since I was a child, like that. So we can identify and we can support the needs of individuals. Every individual has his own like characteristic. So we have to see from this particular side. Also, we need to care for the family, including the social problems. Once we get the trouble in the hospital due to this like geriatric a patient in a hospital, and the first daughter and the second daughter was arguing on each other. So the first daughter asked me, "Doctor, why would you let my sister come to the room?" And I said, like, this is the end. This is the end of the life care and the patient. So we need to support this, including the social problems. We cannot let them like they are arguing about the hospital, about the payment of the bill and anything, because well, national health system also cover, but this somehow being a problem. And also we need to prepare the patients and their family to face the worst possible thing that might be happened. Not only maybe about being passed away, not only being passed away, somehow like the amputation of the feet, such as the amputation of the feet. Like we had young person, young student in Indonesia, 21 years old, I guess, and they had the accident, motorbike accident, and his feet need to be amputated at the time. So as young person, still student, not graduated yet, and the feet will be amputated. It means like it will be something difficult for him to lose one of the he will walk, he will be a successful person. He thought he will like doing sports, anything, and he will not be able to do so. Also, like the chemotherapy is like a cancer patient, a woman cancer patient, and doing the chemotherapy, and somehow she can lose her hair. For the man, like losing the hair, it will be okay. It's only for a while, but for the women, losing her hair is somehow losing the crown. So that's why this is also the social aspect that we need to know. We need to understand that this is the side effect of the chemotherapy, and we hope as soon as possible you will get your hair back. Something else like that, and also and the other thing, and this is giving the support, and we know since we are the team-based care with the doctors and also with the religious people, somehow we can identify when to do, when to start something else. And also the religious people, I'm sorry, I almost forgot, like the religious people, when they see Indonesia is the country, is religious country, so that's why we have 6 religions here in and somehow the people who in dying, we put them dying with dignity. So that's why when the family like needs something, like praying from the priest or pray from the ustad, something else, that from the Muslim and from another priest from another religions, we will provide to them. And of course, with the Catholic people, we'll do the communion. We will prepare the religious communion to them. So that's why they can accept the disease, accept the situation. Also to the family will accept the problem that will be happen. Like the worst possible thing that might be happen is when the patient is passed away. So that's why we prepare them until they can accept this, and then praying together, and they can give this from time to time, and then hoping to rest in peace and go with God. And this slide showing the health services is actually in some places, in some countries also, including the Indonesia or Southeast Asia, we have the private insurance support. We have also the national support or the support from the government. We call it social support and by government, like government insurance. We have also the left corner here, we can see the fee for service or the out of pocket if someone gets sick. So he can come to the hospital and he will pay for the bill. But I would like to highlight the right corner here as also what I've been studying for philanthropy for approximately 4 or 5 years. Here, as we saw at the second slide, that philanthropy is not about the money, but also giving the time, giving the idea, and giving the intrapersonal. What I'm going to say is about when this palliative care and also the end-of-life care support to the hospital, it's unethical if we ask the patient or we put that in the insurance to pay. But if the government, the hospital management can support this through the system of the philanthropy, so we can put the patient and to die with in dying with dignity, and the patient will be getting like support from the family and also from the hospital. So the money to call the doctors, the palliative care team, will be covered by the hospital management through the philanthropy system. Yeah, not from the patient, not from the insurance, but through the philanthropy system. And the last slide I would like to say is about, well, Global Healthcare Summit. We would like to put the word of collaboration, because there won't be philanthropy without collaboration, like any collaboration, private partnership collaboration, or collaboration between the private companies, between the private institutions, private foundation to do the philanthropy. We can see the left pictures here. We can see the left picture. We can see the doctors here, and also the nurse is also part of the collaboration. We can see the right corner, the right picture here. We can also see maybe this is the nurse, and maybe this is not the nurse, but this is maybe a team of the philanthropy of the palliative care team that giving the support. How are you? How are you this morning? Could you sleep well last night? What do you feel today? How do you feel? How do you feel the pain? And what about your family? Would you like to do the video call to your family, because your family can miss you as you are here in a hospital and being treated here and something else, and it's like that. Or you need the sacrament of the Eucharist. We can put the communion to the Eucharist, or maybe you need the prayer, something else. We will give as best as we can. Since this is not the medical support, but this is the social support to the patient, and the collaboration between every stakeholder. It will support the care of the patient, and I hope that these patients, like also the family, will go to the peace, quote unquote, to the peace coming to the hospital, and thinking about that. Some of the diseases cannot be cured, but some of the diseases can be treated. One would like to say, if you treat the disease, you can get lost, but if you treat the patients, no matter what, you will be always as a winner. So the collaboration here with the Health Philanthropy, I will answer my self questions that yes, the Health Philanthropy can also support the palliative and also the end of life care in a hospital. As such, we can show this in our hospital, in Philanthropy Hospital in Yogyakarta, as a 93 years private hospital, Catholic hospital. So we would like to show this. I hope that the people around the world can also put the collaboration and to build the philanthropy ecosystem to support giving the palliative care and also the end of life care. And those are my presentations and all the slides. So thank you so much for the opportunity.